Hey guys, my name is Dr. Arora. I'm a TMG and sleep apnea dentist. My practice is the TMG and sleep doc is in East Haven, Connecticut in US. So we had a patient, Patty, 36 years old. Chief complaint, chronic headaches 7 days a week. In the front, in the sides, in the back, neck pain, shoulder pain, chronic headaches. So she went to a neurologist. She was on medication for like almost 6 months. They were like subsided, but not 100% gone. She went to a chiropractor. He adjusted her vertebrae. Headaches did not go away. Eventually, she was referred to a prominent headache center in Maryland. They did all the tests, blood test done, saliva test done, hormonal test done, CBC done, MRI done, okay, sleep test done, allergy testing done. Eventually, they figured out that there are certain foods that contributing to her headaches, some food allergies. So she was asked to keep a symptom and food and symptom diary. So after 2 weeks, they figured out their 5 foods and told her to not to take them. So she followed religiously whatever she was asked to do, and but the headaches did not go away 100%. So eventually, she came to Connecticut. She was referred to a physical therapist in Connecticut. So physical therapist referred her to me actually. Doc, let's have a look. So the first thing I observed was head posture like that. She was like that all the time. She was with me for like an hour. Initial evaluation. I was looking at the posture. It has to be ears and neck has to be in one line. Head posture has to be straight. Head is like a weight of a gallon, and that gallon is just resting on the spine all the time. If it's like that, it puts a lot of undue pressure on the spine. That can cause the neck pain, shoulder pain, backache I have seen. So, and when I look into the mouth, tongue thrusting, tight tongue, high palate. Okay. Her, like when the tonsils were grade 3 tonsils, they're blocking the airway, inflamed red tonsils. So she couldn't even like breathe properly. So I sent her to an ENT. ENT said, okay, doc, we can't relieve the tonsils. So, grade 3 tonsils. Okay, let's take them out. But she did not have, like, they have a insurance, some ruling that it has to be have 7 episodes. Okay, I said, come on. She is like not sleeping well. She's not even breathing properly. Okay, so I don't know, like it is still they're figuring out. But the problem is, second issue is the mouth breathing. So she is a big mouth breather. I said, okay. Then she has a like a high palate, deviated nasal septum. The ENT said, doc, it's a deviated nasal septum, obviously due to the high palate. The first line of treatment was myofunctional therapy. Stop the mouth breathing. Start the nasal breathing. Second, expand the palate. At this age, it's hard to expand the palate with a regular palatal expander. So we did a skeletal expansion with Marpi expanders. I put it on her and it is working, not 100%, but yes, because before we release the tongue, it has to, we need a parking spot for the tongue. Where the tongue will go, the tongue has to rest on the palate after the release excision. If the tongue can't find her like spot on the rest on the palate, where the tongue will go, it will go back and block the airway again. Okay. First is myofunctional therapy. Condition the tongue, stop the mouth breathing, stop the tongue thrusting, and condition the tongue for the excision. After a month, and we gave her certain myofunctional exercises. Keep the tongue on the palate. Every half an hour, she was reminded, okay, tongue the palate straight, tongue, palate, lips closed, teeth apart, breathe through the nose. And she was told like 40, 50 exercises. Every week, I was spending like 20, 30 minutes with the myofunctional therapy. Tongue exercises, suction exercises, lip exercises, all kinds of exercises with her. After like 6 weeks, she felt, doc, it is working. She's stuck. Okay, she was religiously doing everything, whatever I was telling her to do. After 6 weeks, she said, doc, headache is like, it's not gone, but it is not as intense. So we release a tongue tie after 6 weeks. Exercises becomes like continued. And I made her a sleep study done again. AHI was 18 times per hour. She was stopping breathing. Okay. She was given a sleep orthotic that bring her lower jaw forward, tongue forward. That helped us to sleep. That she was getting oxygen now. When she was getting oxygen, she was a heavy grinder before. Her grinding almost getting less and less. She was getting oxygen, grinding becomes less, grinding becomes less. Because grinding, due to the low oxygen, the body was grinding the teeth because grinding opens up the airway. When she started getting oxygen, the grinding becomes less, headaches becomes less. Grinding creates a lot of friction, almost 200 to 300 pounds of pressure that was transferring to muscles and the nerves. With the proper oxygen, the headaches becomes less and less. Because when you are not breathing properly, body is not getting oxygen, first thing is you grind your teeth. The body lets grinding the teeth. The body's main function is to keep you alive because grinding of the teeth brings the lower jaw forward and gives you oxygen. Second, when the body is not getting oxygen, the brain is all dry, okay, the irritated, the nerves are irritated. So with the oxygen, with the sleep orthotic, the body was getting oxygen, grinding becomes less, and headaches becoming less and less and less and less. After about 6 weeks after delivery of the sleep orthotic, she said, doc, it's 50% gone. My headaches are 50% gone. She has a like myofacial trigger points here. I gave her Botox and I did the manual craniosacral therapy. And after about like 6 months, she said, doc, I'm done. I'm no more headaches. It takes time to relieve it. Okay. So you have to religiously follow all the procedures, all the instructions. Any headache issues, please call my office, the TMJ and Sleep Doc, 203-469-5644 is in East Haven, Connecticut. If you like the video, please like it, share it, subscribe it. If you don't like the video, okay, please block me. That's what I can say. Any questions or comments, please write down in the chat box. I'll do my best to answer them as soon as possible. Thank you so much.